Under the administration model, let's talk about companies, which is already open. Now, this is where you can register companies that want to subsidize or pay the medical bills of their employees. You can use this Add button to add a new company, filling the necessary details like the company name. Active, if you want it to be active immediately. Discount rate, the GL code, the email, if you want it to stick to a service list which you will provide, the phone, the address and all that, then you can add. I'll cancel this. To assign a service list to any of the companies, we select the company and click on the Assign Service List. Currently, this company has no lists. Now, you can either import a list you already have, or you can simply add new. You can use the search button to search specifically for the service you want to add. You can add services under General Service or Pharmaceuticals. Under the General Service, let's select Lab. We have different services under the Lab. Let's say for blood group. The company wants to pay for complete services. They want to cover the whole services for blood group. Under genotype, they want to cover the services. And under blood transfusion, they want authorization to be required. And then after adding, you simply cancel. And there you have it. You have the section, Lab, the services, you have the blood group, the blood transfusion, and the genotype. Now, for the blood group, they cover the services. For blood transfusion, authorization is required, and then the genotype is covered. You can add as many services as you want by clicking on the Add button again. Then anyone under this company will benefit from the services. Next is the patient categories. This enables you to create a category of patients, example VIP or charity, and assign a service list to them. To add one, we'll click on the Add New. Category name, let's say, charity. Category description, I'll leave that blank for now. Discount rate, let's say we want to give them a 50% discount. And then we add. So anyone under this category will have a 50% discount. We can then assign a service list, so that we can define the services that will benefit from this discount. Assign services. Just as previously discussed under companies, you can select as many services as you want. This time around, let me just select services under pharmaceuticals. Let's say, essential drug. We can say they can get a 50% discount from all these drugs. So, simply use capitated and then cancel. For this malaria drug, anybody under the charity list will have a 50% discount. Next is the health insurance companies. For health insurance, you can add the companies that your organization works with and assign health plans to them. Let's review an existing one, for example. I can either use the buttons here or the buttons here. So let me view the members. There are 2 members benefiting from this insurance company. Now let's look at their plans. Currently, they have only one plan, which is called Premium Plan. So you can add a new plan. I'll select the insurance company, which is THT. Say this one is private. The discount rate. What the patient pays. The percentage of their drugs. Let's say they pay 60% of their drugs. And these are the capitation details. You can fill in the rest of the details. And then add. And here we have a private plan. For this plan, you can now assign a service list to it. So just like mentioned before, use this button to add the different services you want people under this insurance plan to benefit. Let's simply say, they have a covered service for chest X-rays. Any patient that is registered under this insurance can get this service for free. The next is the subscription plan. The subscription plan works hand in hand with the patient categories. You can create a subscription plan that can waive some fees, like consultation fee for a patient under that subscription. You can also use this button to assign a service list to a subscription. So let's say, for example, someone that is under a monthly subscription of $1,000. You can say the person can come to the hospital or the clinic without paying consultation fee or any fee that you choose to waive for them. Next, we have duties. Now, under duties, you can set up various work shifts for the staff. Define the title, the start time, and the end time. You can assign staff to shift. Under the scheduling model, duty roster. Here, you will see everyone on duty this week. You can also use this button to see people on duty the previous week and people that are on duty the coming week. To add a new roster, click on the Add button. Here, we select the dates. Let's select some dates. And then select Duty ID. Let's say for afternoon shift. And then you select the staff that will be on the afternoon shift on this date. Select. Let's say these two staff will be on duty. And then we add. So they will come up here. Let's add another one for the evening shift. Let's say this same dates. We say, for night shift, I'll select this person. And then we select this person, and then we add. So you can see people that are on duty. You can filter it by night shift or afternoon shift.